The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. Every week I will discuss health-related issues that pertain to our community. To learn more about my practice, go to drtommyo.com. That's drtommyo.com. If you prefer to stop by my office, it's located at 250 Patchogue Yaphank Road, Suite 16, East Patchogue, New York, or call us 631-980-8200. That's 631-980-8200. To my military family, I got your six. To my Masonic brothers, the light is bright. Well, I want to welcome Ms. V to the show.
Good morning, Doctor.
How are you today?
Good. How are you?
Well, we had a special night, special evening.
Yes.
All right. I'd like to thank the Greater Patchogue Chambers of Commerce for sponsoring a grand opening and ribbon cutting ceremony. To those who joined us, thank you. A special thanks to my wife, Kathy, and my daughter, Gabby, for their help preparing the food, as well as Paul and Alyssa for their adult beverages. Also, Ms. V, you brought some dessert.
I brought the appetizers.
The appetizers. Yes, we had a fresh mozzarella.
Yep. We had the caprese salad and the antipasta and some salad,
Yes, well, it was a wonderful night.
It was the Italian touch to the evening.
Yes. Well, it's family. That's what I keep saying.
Definitely.
When you go into the practice, the office itself, when you're a patient of mine, you're family. And that's what we had last night, a nice family gathering. So before we get into today's show, I'd like to, go over a disclaimer so you have an understanding. This show is about educating the community. The Ask Dr. Tommy O Show is not intended to be a substitute for the medical advice of a licensed physician. The listeners should consult with their doctor in any matters relating to their health, and particularly with respect to any symptoms that may require diagnosis or medical attention. Before beginning any new health plan or program, the listener should seek medical advice from their personal physician. If you do not have a physician or are unhappy with your current physician, please call my office. I would be more than happy to care for your needs. We offer a very affordable concierge practice. So if you go to my website, drtommyo.com, you can learn about the practice and the membership. So today's topic is hypertension.
Hypertension, yep.
This is an important topic. What is hypertension? It's also known as high blood pressure. This is a condition where the force of the blood against the artery walls is increasing. Well, what does that mean?
Well, basically, hypertension. I have hypertension, and I'm always under pressure, lifestyle changes and everything. And a lot of questions come up with that. Like, for instance, what is considered normal blood pressure? Right.
Well, normal blood pressure, we use a reference. We say 120 over 80. That's right. the reference number.
Right. And is a one-time reading of 140 over 90 considered hypertension?
No. In order to be defined to have hypertension, Typically, we reference 3 abnormal readings, 3 consecutive abnormal readings of greater than 140/90. Okay, not 1 reading,
Right.
3 consecutive readings.
Okay, and what about that term that I've been hearing called white coat syndrome? What is that?
Right. Well, you hear this, and the patient will come into your office and goes, "Doc, I'm real nervous. When I come to the doctor, my blood pressure goes up." That's the white coat syndrome. This is when you enter the office, you see the doctor. Traditionally, doctors wore white jackets, white coats, right?
My pressure would go up.
Yes. It's a very stressful situation. Your anxiety levels start to increase, and then your heart rate increases and your blood pressure increases. So you get a higher reading than normal.
Right.
So that's what we call white coat syndrome.
So how do you, if someone has that and they come into your office, like, how would you address their elevated blood pressure?
Well, the first thing you do is when I enter the office, before I even do anything, I want to have a nice conversation with them. I want to bring down their anxiety levels. I want to make it fun. I want to make my patient, feel like family and have a nice casual not relationship. Yes, it is a relationship, but a nice casual conversation.
Definitely.
Just, to bring down that tension, that break the ice. And, you get them to laugh, and we find out what we have in common and see how their family are doing. And, they went away on vacation. And right away, that just takes that edge off. And by the time I start to do the actual physical and the exam, check their vitals, their blood pressure, their heart rate, it usually stabilizes and lowers, and they feel much better.
I think a lot of people that go into their doctor office visits, their blood pressure is elevated before they even get there because they're not really happy with their doctor. They have anxieties about what the doctor's going to do.
Right.
I have a lot of family members and friends that they dread going to the doctor because they're going to get stuck with a needle or the doctor's going to tell them some bad news. They don't have that relationship like you have with your patients where they would feel comfortable enough that the pressure would naturally come down a little. You know?
Exactly. Well, it's making the patient feel comfortable. My office is a very comfortable, inviting environment.
Yes.
Last night we had a lot. Again, I want to thank our community for showing up. We had a lot for that ribbon cutting.
It was nice.
It was, and in the patients, I want to say patients, but those who showed up, they were impressed. They really enjoyed the walkthrough and just discussing the history that's, the artifacts that are on my walls. And actually, it represents, actually you and I were both Italian, so it represents who we are as individuals and what we do in the profession as being in the medical field.
That's right. So
that alone helps relax my patient.
People like to learn, and they learn about a little bit of what is behind the medicine too.
Yes. Well, I always say it's look, listen, and feel. I look at the patient. I want to see them. I want to see their facial expressions, the emotions, because that's telling a story. I listen to them. A lot of doctors, when your back is to them because you're typing on the computer because you're afraid of, you got to type these notes. Well, you're really not listening to them. Right. And so I'm listening to them. I'm listening for that force, that amplitude, that velocity of what they're saying, because that's telling a story as well. And then I feel them physically. I feel them also emotionally. You have to have all 3 components, because if you're missing a component, you're really missing a piece of the puzzle and you're missing part of the story.
And I think the hypertension is silent. So
yes.
It's a silent killer. And you'll be able to, experience something and know by listening what's going on with them. So.
Right, exactly. Hypertension is known as the silent killer. What does that mean? Well, what that means is that you might not necessarily have signs and symptoms of high blood pressure. How do we tell? You come in and I say, hey, your blood pressure is a little bit elevated. Let's repeat this in a week. And they come back again. It's still elevated. Well, let's repeat it again. If it's still elevated, we got to, and each time I'm discussing diet modification, lifestyle changes. And then it's the third time, then we have to discuss how we're going to manage this. And we discuss this as a team. We work together as a team. How are they going to best benefit from this?
That's right. So I know how they can. They can call today and set up an annual physical and have Dr. Tommy O check your blood pressure.
Right. No, it's that's one thing that's missed. If you're not sure, you can come to my office or run over to a local, franchise pharmacies. A lot of time they have one of those either free. You have to put a few coins in and they can check your blood pressure, or have the pharmacist check your blood pressure. If you're not happy, then you give us a call. Or if you're not getting the care from your current physician, that again, if that relationship, just give us a call.
Yeah.
give us a call and we can make a difference here for you. So again, let's go over a few things. Again, how important is hypertension or having your blood pressure checked? Very important.
Very important.
Very important, right? It's a silent killer. And we'll go into the number of patients, a number of Americans that have hypertension when we return back from the break. And the number is staggering.
Definitely.
The number is staggering. All right, so we're getting ready to go to break. So to learn more about my practice, go to drtommyo.com. That's drtommyo.com. drtommy.o.com. Or if you prefer to stop by my office, it's located at 250 Patchogue Yaphank Road, Suite 16, East Patchogue, New York, or call 631-980-8200. Make that call.
Come see us.
Come see us. We're here for you. We'll address one thing. I've had a lot of patients calling, trying to get in, making appointments over the past 3 weeks. We are taking patients. We're accepting patients. Give us a call or go to my website. The website is very informative. It will educate you on what I do in the community, what I do as a physician, how I serve you, and I'm here to make you live a healthier and a happier life. Call us. Welcome back to the Dr. Tommy O Show. I'm here with Miss V.
Hey, Dr. O. I just want to encourage everybody, please call today and set up that annual physical. Have Dr. Tommy O check your blood pressure. It's so important. Speaking from personal experience, it's so important.
It is. Today's topic is hypertension, so let's continue with the questions and answers section here.
We had a lot of questions come up, and I think one is really important. How many people, what percentage of adults in America have hypertension?
Yeah, according to the Centers of Disease Control, that's the CDC, nearly half of the adults in America suffer from hypertension. Half.
That's a lot.
Half of the adults.
That's a lot. I mean, I know a lot of people. Like everybody, like every other person that I know has it.
Right. Well, did you know that only 1 in 4 adults with hypertension are under control?
I believe that.
Yes, or have their hypertension under control.
A lot of us, there's so much going on in life, even recently with COVID and everything, that nobody likes to go to the doctor anymore. So it's like everybody has these symptoms and these issues, but they're not treating it.
Right. Yeah. Well, the other thing is if you don't have insurance, you're not going to the doctor.
Right. That's true.
So you're not... Your health, you're not having your health evaluated. You need to be examined. And I have an affordable concierge practice that if you don't have insurance or you have the extremely high deductibles,
right,
we made it affordable. So we're here for you to make that call, make an appointment, and I can care for you. That's what you deserve.
Knowing that so many people have this and that it's it's a big problem that it is. Why is it continuing to go on like that? Like, why does this happen? What's going on out there that this is going on like that?
Right. So some of it is a lack of compliance. Patients, you need to follow medical instructions.
Right.
And why would someone not follow medical instructions, what we call non-compliant? Well, it's lack of confidence with their current physician's ability to manage their hypertension.
Right.
And you're like, well, are you, really? I said, yes. Not all physicians are made equal, and it depends on your training. If you trained before me or you trained much later than I, we had the Framingham Heart Study, and that was a game changer in how we treated hypertension, and that was being implemented right in 1990-91. This is almost 32 years ago, 32 years ago. That's when I was in medical school, and that changed. We had all new medications and a new approach, and you didn't see heart attacks or you don't see individuals that are having heart attacks dying from heart attacks, and after a heart attack, they were surviving a heart attack, and we were giving them medications. If you go back, I remember when I was a child, I had my neighbor who was a few years older than I am. His father passed away. His father was only 55 years old, and that was typical from a heart attack.
Right.
We're not seeing that today because of the medications. No. Yep.
And basically, they just and then doesn't the Framingham Heart Study do the water pills?
No. Those are adjunctive therapy, which we'll go into. But let me just continue with this, and then we'll we can cover that. The wrong medications or medication subtherapeutic. And you're saying, well, wrong medications. Yes, there's different medications, and they're based on genetics,
right?
Which I'll go a little bit. I want to cover a few things, and I'll discuss that. I don't want to get too technical. The medication is subtherapeutic, meaning the dose is not high enough that it can actually work. Okay, so that's what we call subtherapeutic. A poor diet, fast foods high in salt and saturated fat. Again, diet modification and lifestyle change.
Right.
A sedentary lifestyle, we call couch jockeys. You got to get out there. You have to exercise. Walking to the fridge and lifting a 12-ounce or 6-pack is not considered aerobics and weightlifting.
I know a lot of people that do that.
Hey, you come home, I know you're working hard. You come home from work and you just want to sit down and turn on the boob tube and then just, crack one open and put it down. But, those are empty calories.
Yeah.
Empty calories. All right. So, okay, now you asked me a question about the Framingham heart study, and I said it's a game changer. And these medications are based on genetics. I'm able to prescribe medications. Well, before that, prior to medical school, prior to 90, we had the alpha blockers, and then you had your water pills.
Right.
Well, when I started medical school, then that's when we started to implement beta blockers, calcium channel blockers, and ACE inhibitors.
Right.
And so your alpha and your water pills became fourth-line medication and an adjunctive therapy.
Right.
So that wasn't my drug of choice. I'm looking at the genetics, because certain medications work a little bit better based on genetics. So, physicians, I see the young generation that are coming out now, and they're starting to prescribe water pills. Well, there's a lot of pressure, insurance companies and, being pressured to start prescribing those because they're less expensive than the ACE inhibitors, the beta blockers, and calcium channel blockers. But what is the goal? The mission is to lower the blood pressure, but to prevent end organ damage.
Right.
And quality of life. I have you on a water pill. All you're doing is going to the bathroom all day long. That's not quality of life.
So, how do you recommend that we treat this then?
Well, again, you have to have, you're going to go to someone who really knows the hypertension, and understand the Framingham and heart study. And then, you're going to sit down with the physician. You're going to look at their lifestyle. I look at their background. I'm going to look at their race and genetics. And then I'm going to explain, again, education. We say knowledge is power. I'm going to educate the patient on what the medication is, how it works in the body, and how much blood pressure reduction they should expect.
Yeah.
How many times you go to your physician and they say, well, you have this, this, and this, and okay, take this, and then they're walking out the door. It's 5 minutes.
Exactly.
That happens more often than not.
That happens all the time, and they don't even want to hear how you feel about side effects or anything else, and they just load on the prescriptions to you.
Right. And so, so now you leave, you go home to your family. Well, what did the doctor say? I don't know.
Yeah.
Well, what do you have? I don't know. Well, what are you taking? I don't know. How does it work? I don't know.
Right.
Well, if you keep saying I don't know, you get frustrated. And when you get, right, because I am human, I am a patient as well, and you get frustrated, and then you give up. You say, forget it. I don't care anymore.
So you left the doctor's office not educated, not knowing what's going on, and just being full of medication.
Full of medication with full of emptiness.
Exactly.
And you become non-compliant.
Right.
Non-compliant. Well,
But
that's not going to happen. No.
With you, it's totally different.
That's right. I'm going to educate you. When you leave, you're going to have plenty of knowledge.
Yep. Knowledge is power.
Knowledge is power. All right, it is. I'm telling you. So, and then how do we get involved in treating hypertension? It's diet modification, and you have to do an aerobic exercise program, and you need to make better choices. And before you start, diet modification and exercise program, you really need to see your physician, get a thorough history and physical. And that was last week's discussion, how important a history and physical is, because it gives you a baseline of knowledge where we're starting off. That's the foundation. That's what a history and physical is. We do blood work, and then I can say, okay, you're cleared to start a physical fit program, an exercise program, and we're going to discuss diet. And every time you come in, I'm going to educate you on your blood pressure. I'm going to educate you on your previous visit, your labs. I want to make sure you're compliant. I want to make sure you have an understanding we're working together as a team.
You'd be surprised how many people go, and then you ask them, when was your last physical? They don't even know.
Right.
Years.
They
have no idea that this is something you should do annually, if not every 6 months, So, that's why everybody should call today and set up an annual physical and have Dr. Tommy O check your blood pressure. It's so important.
Right. I'm here for you. This is an affordable concierge practice. Whether you have insurance or you have, insurance with the high deductibles. We had several patients call that have insurance. And don't be afraid. If you have insurance and you're not happy with your current relationship, you can come to me. I will care for you, and I will give you an invoice, and it will cover the $100 a month membership.
You'll get it back.
You will get that money back. So
it's a no-brainer.
This is a no-brainer. Make that call. I'm here for you. We're going to make a difference. All right, so next week's topic, we're going to be discussing diabetes. So tune in. All right, to learn more about my practice, go to drtommyo.com. That's drtommyo.com. If you prefer to stop by my office, it's located at 250 Patchogue Gap Bank Road, Suite 16, East Patchogue, New York. Or give us a call, 631-980-8200. That's 631-980-8200. Come and join my practice. Let me help you lead a happier and healthier life.
Give us a call.
Give us a call. We're here to make a difference in your life as well as in our community. Again, I want to thank everyone for coming to the grand opening and ribbon cutting ceremony.
Thank you.
Thank you.
The content heard on the Ask Dr. Tommy O show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.